here is your question. Right. So if you have read and understood, considering a clinical examination petition, kindly begin.
Hello, I'm Dr. Hiski, one of the surgical assistants of this hospital. Can I confirm your name and age, please?
Yes. 23 years old. Mantha.
Nice to meet you, Mentha. Today I have been asked to examine your shoulder, uh, which include looking at it, doing some movements and doing some special tests. Will that be okay with you?
Yes.
Are you in any pain at all right now?
Yes. I do have pain.
I'm so sorry. Do you want any painkillers right now?
No, that's all right. You can go ahead.
Okay. So before we proceed, can you please remove your gown for me?
Yes.
Thank you very much.
Instruct.
So,
Keep your undergarments on.
and keep your undergarments on.
Yes.
Thank you very much. So can you please walk a few steps for me and come back to see I want to see the arm swing.
Okay.
And could you please push your hand to the wall?
Okay.
I look for winging of the scapula. Then I look for any shoulder, both sides, any deformity, erythema, swelling, any sinuses, any muscle wasting. I'll check beneath and the armpit also on the both side, and I'll check from the front and the back of the shoulder, and then I'll ask again I'll ask that now I'm going to feel your shoulder region, and do you have any pain? If you get any pain, please let me know. I'll be as gentle as possible.
Yes.
That be okay?
Yes.
Now I'll check for temperature on both sides, tenderness, starting from the sternoclavicular joint, feeling the clavicle, acromion, and the shoulder joint, and inside from the medial part of the upper arm, the humeral head, and the base area. I'll look for any tenderness, and then I'll check for humeral head moving the arm, medial rotation and lateral rotation, bicipital groove. I'll feel it, and I'll feel for the muscles, the trapezius, the deltoid, biceps, triceps. These muscles I'll feel, and then I'll do the movements. I'll ask, can you please move your hand over your head? Thus I'll see the abduction. Then can you please put your arm tucked by your side? I'll check the adduction, and then I'll check for flexion by asking to move the arm forward, and ask, can you please move the arm backward? I'll check for the extension, and then I'll show her the circumduction movement, and I'll ask to repeat it. Then these movements I'll do passively, and check for any crepitus on the shoulder while doing the passive movement, and I'll check for muscle power, the internal rotation, external rotation, abduction, adduction, all this flexion, extension. I'll check the muscle power, and then I will do one test, that is Garber's test. I'll ask to put both hands behind your back, and I'll push. Can you? And I will ask the patient to push my hand to check the Garber's test, and then I'll do one another special
This
near
test
test.
is done to check the efficiency of which muscle?
This is done to this is trapezius.
Subscapulary. Okay,
Sorry,
next.
subscapularis one, yes.
Yes.
And then I'll do the nears test, which is done by putting on the arm by the tucked by the side. Here, the forearm is pronated, and then I will move the hand forward flexion to check when there is any pain or not, which will show rotator cuff impingement. If pain reproduce, then it is positive for rotator cuff impingement. And then I can do one apprehension relocation test, which is done by externally rotating the arm and then extending the arm. I'll feel for the uh, I'll feel at the shoulder joint. If there is any pain occur, that is also positive for uh, rotator cuff impingement. And then I will check for sensory innervation of the badge area for axillary nerve. And then uh, that's pretty much it. Uh, I'll ask him. I'll thank the patient, and then I will ask him to redress. Thank you very much.
Okay.
And I'll finish my. I'd like to do. I'll finish my examination by doing the neck and spine examination and elbow examination.
Can you please summarize your examination now, please?
Today I have examined a 23-year-old Miss Samantha, who is on shoulder examination. There is no scar, sinus, erythema, any muscle wasting, or any skin deformation in the on inspection. On palpation, there is a slight tenderness on the right shoulder, uh, tenderness on the both shoulder, and uh, there is movements are restricted on abduction.
Yes.
Above
To what
90,
grade?
above,
Yes.
yeah, above 90 degree,
Yes.
and then
Between 90 to 120 degrees.
90 to 120 degrees.
Yes.
Overhead
And
abduction is restricted,
any
and
other
then there is
test which was positive?
an nears test, and this Garber's test is positive.
Okay, so considering your examination, what are your provisional and differential diagnosis?
So my provisional diagnosis rotator cuff tear,
Yes.
and differential diagnosis is osteoarthritis or any rheumatoid arthritis.
How would you
Uh,
confirm your diagnosis?
I do of more complete physical examination after history taking and physical examination. I'll go for in some investigation. I do start with X-ray of the shoulder joint, and then I could do MRI of the shoulder joint to check any for the rotator cuff tear.
Okay. What is the management alternative that you can offer to this patient?
So if it is a rotator cuff tear, then at first we can do conservative management. There is rest, and then ice compression, and um, ice compression, then resting of the arm, and then intraarticular steroid injection could be given, and
Yes.
analgesics.
If conservative management fails, then what is the management that can be
Yes,
offered?
then we can go for surgical procedure, arthroscopic procedure, and repair of the rotator cuff.
Okay, good. Thank you.
Thank you, ma'am.
If we can discuss how, because after a while you have presented, and in this one, because we're doing it virtually, one thing, and with the camera off, so I cannot see. Because I cannot see, so I was just assuming that you made the patient stand, or whole examination was carried out while
Standing.
patient was standing.
Standing position, yes.
Yes. So this is like important to explain because I can't see. So I have to be sure how would you be keeping your patient on the day of examination. And then it says that whenever you're examining a joint above and joint below should be examined. So what did you say, which joints would you examine?
Neck and spine and elbow
Cervical
joints.
spine and elbow.
Cervical.
And then complete neurovascular examination of the upper limb, if time allows. This you
Yes.
have to mention. Right. And the positive findings were okay. Your provisional diagnosis was also right. In the beginning, when you were saying that you'll ask the patient to push against the wall, would you do it right away or would you do the inspection first?
I could do. I could in one. In one videos I've seen that, and
Yeah,
uh,
they ask to do it right away. But then sometimes in another thought, it says that maybe you can do the inspection first and then you do the palpation. Okay, one thing that you missed in palpation, can you recall? You did tenderness, you asked for tenderness, pain, you
temper.
checked for temperature, and then radial and brachial pulse you have to take.
Yeah. Okay. Okay.
So this you have forgotten. And then in this order, you did it right. You done the active movements first, and then you went for the passive movement, and then the special test. And at the end, when they say when you're doing the neurological examination, then you can ask the patient to do the push against the wall to rule out the long thoracic nerve.
Yes. Yes.
So that is another way. But whatever method you adopt, make sure you cover everything and you don't miss out on anything. So that was right. Okay, good. Thank you. How likely it is that if you'll give intra-joint injections of steroids, how helpful are these in this kind of situation? When you
This
know that it's rotator cuff.
helps for time being. This helps for time being.
Yeah, but it's not ultimate management.
Yeah.
Ultimately, you
Yeah.
have to go for repair
Repair.
once
Yes.
it's not, yeah, healing with the conservative management. Good. Thank you.